Assalamu alaikum. Today we will talk about how thiazide drugs works in diabetes insipidus. For that reason, at first we should know what is diabetes insipidus and what occurs in diabetes insipidus. In diabetes, today we will not talk about all type of diabetes insipidus. We will only talk about nephrogenic type of diabetes insipidus. So, as we say that nephrogenic type of diabetes insipidus, so you can understand that there is some sort of pathology in nephron or in kidney. In diabetes insipidus, there is decreased ADH level, or the ADH cannot work. And in nephrogenic diabetes insipidus, the ADH is produced in normal level, but it can't work in kidney. It can work in nephron. Why? Because the receptor for ADH, that is V2 receptor, is sensitized or isn't expressed, and as a result, antidiuretic hormone can bind to its receptor. Now let's see what happens when antidiuretic hormone binds with V2 receptor. When antidiuretic hormone binds with V2 receptor in the principal cell of the collecting duct, that is which is situated in the collecting duct, such as antidiuretic hormone binds with V2 receptor. When it binds, it causes cyclic GMP to be increased, and increased cyclic GMP produces or expresses two channels, that is aquaporin channel AQP2, aquaporin channel, aquaporin 2 channel, and this aquaporin is expressed both in apical site and both in basal site. And presence of aquaporin channel in apical portion or in basal portion causes water to be absorbed within the principal cell, and this water then pass to the basolateral site and to the blood vessel, and the water is then remain in the body, and the more water is absorbed, so the urine become concentrated. So when you get too much water, or you drink too much water, then your more water will be excreted through urine, and when there is water deficiency in your body, then more water will be absorbed through aquaporin 2 channel by the action of the antidiuretic hormone. And antidiuretic hormone also expresses ENAC. What do you mean by ENAC? That is epithelial sodium channel, and this epithelial sodium channel also causes sodium to be enter in the principal cell, and by as a result sodium is entering in principal cell, so water will also enter in the principal cell with the sodium, and as a result the urine will be more concentrated. So when you have antidiuretic hormone deficiency, or when your antidiuretic hormone cannot work or cannot bind with V2 receptor, you will have lack of all these receptors, and you will lack of aquaporin 2 receptor, you will have lack of epithelial sodium channel receptor, so water cannot enter into your principal cell. As a result, more water will be, or all the water will be excreted through your urine, so your urine have more water amount will be, water concentration in your urine will be too much. But think that the sodium channel, as sodium is already absorbed in proximal duct and late distal tubule, so proximal collecting duct, late distal tubule, so your sodium concentration will not be too much in the urine, but the water concentration will be too much in the urine. So as a result, your urine concentration will decrease. Urine concentration why will decrease? Because more water is excreting through the nephron. And in these circumstances, if you use, or if you express, or if you enter ADH into circulation, it cannot work. Why? Because there is sufficient amount of antidiuretic hormone in your blood, though it can bind with V2 receptor. So if you give antidiuretic hormone to the patient, it will not give a sufficient action, or its action will not be the same, and the patient will not become better. So what is recommended in that case? In that case, we recommend thiazide diuretics, especially hydrochlorothiazide. how this hydrochlorothiazide works. and how it causes diabetes insipidus and how it helps in diabetes insipidus. Hydrochlorothiazide or thiazide group of diuretics works in the distal convoluted tubule. In distal convoluted tubule, there is a sodium chloride symporter in the apical portion of the cell, and it blocks this sodium chloride symporter. So when this sodium chloride symporter is blocked, sodium and chlorine cannot enter into the cell, and as a result sodium and chlorine can enter, so water will also cannot enter in the cell of the distal collecting tubule. And as this patient has nephrogenic diabetes insipidus, so he cannot also absorb water from the collecting duct. As a result in this case, both water and sodium will be secreted or will be excreted from the urine, and this time his urine concentration will be high. As a result, when his urine concentration will be high, this causes his plasma concentration to be low, and also there is decreased plasma sodium concentration. So his urine concentration become high than before, and his plasma concentration decreases as from before. As a result, when amount of sodium or concentration of sodium increases, juxtaglomerular apparatus from the kidney can sense it, and when juxtaglomerular apparatus can sense it, it will secrete renin, and ultimately renin causes renin-angiotensin-aldosterone mechanism to be started, renin-angiotensin-aldosterone system to be started. And what happens when renin-angiotensin-aldosterone system started? When renin-angiotensin-aldosterone system started, angiotensin is produced and aldosterone is produced. Let's see how angiotensin works here. Angiotensin have AL2 receptor both in endothelium of the blood vessel and both in smooth muscle of the blood vessel. So when it acts through the ALT2 receptor in the endothelium of the blood vessels, it decreases nitric oxide production. When it decreases nitric oxide production, you know that nitric oxide causes a smooth muscle to be relaxed, and as a result of working in the endothelium and decreased production of nitric oxide, so smooth muscle cannot be relaxed, and it also work on the smooth muscle of the smooth muscle of the vessels through the ALT2 receptor. So his smooth muscle will be constrict. As a result, his vascular endothelium and smooth muscle will constrict, so his glomerular filtration rate will be decreased. Why glomerular filtration rate will be decreased? Because glomerular filtration rate depends on the blood flow. As a result, the vessels become constricted, so the blood flow also decreased. As a result, blood flow is decreased, his glomerular filtration rate is decreased, so less amount of filtration, so less filtration occur, and as a result of less filtration occur, so it will be absorbed through the proximal convoluted tubule, and the supply of it will be more absorbed in proximal convoluted tubule, and the supply of water to the distal convoluted tubule, which is antidiuretic hormone dependent, will be less. So more water, as a result, more water will be absorbed here or reabsorbed here, so the supply of water in the distal convoluted tubule and the collecting duct will be less, so there shouldn't be need of any antidiuretic hormone dependent reabsorption, because already water will be absorbed from proximal convoluted tubule. And as a result of increasing level of aldosterone, more sodium will be absorbed, and more sodium will be absorbed from all over the nephron, and because the sodium concentration of the sodium in the plasma decreases due to working of thiazide. So as a result, sodium level is decreasing, so more sodium will be reabsorbed. More sodium will be reabsorbed from proximal convoluted tubule, from distal convoluted tubule, not from distal convoluted tubule, mainly from proximal convoluted tubule. So as a result of increasing amount of the sodium to be reabsorbed, water will also enter with sodium into the cells of proximal convoluted tubule, and it will go to the blood, and as a result his blood pressure will be increased or his diuresis will be decreased. So by this paradoxical effect, thiazide increases the concentration of the urine, increases the concentration of the urine and decreases the concentration of the plasma. Thus, it acts on the nephron to reabsorb more water and more sodium from the nephron. That's why we should use thiazide in nephrogenic diabetes insipidus. Thank you for all.